Hi, and welcome back to the second hour of Focal Point, this Tuesday edition of Focal Point on AFR Talk. I am Brian Fisher, the program Focal Point Network, AFR Talk, 888-589-8840, number to call. This is a desperation move on the part of President Obama, this removal of the caps, and it broke in the New York Times. Let me just give you the details. But this is a desperation move on his part because if you have caps on what an individual has to pay out of pocket, it raises the cost of premiums because anything over that cap then the insurance company is liable for. They've got to raise premiums, so they've got resources on hand to handle those demands. So this is President Obama trying to keep the cost of your premiums down until after the election. This is a blatantly, abjectly, dismally political ploy on the part of the president. Meanwhile, in 2014, people who normally would benefit from those caps, which the president promised were going to be in place, he said that's one of the great things about Obamacare. We get to 2014, there's going to be a cap on how much you're going to have to spend out of your own pocket. Anything above that, we're going to soak those evil, greedy, rich insurance companies. We're going to stick it to them. We're going to nail them to the wall. They're going to have to pay. We're going to stop letting them take advantage of you. That's how they're presented the thing. And now getting up to it, and he's realizing that is going to drive, already we're looking at insurance premiums going up anywhere from 100% to 400%. If these caps are imposed starting in 2014, it's going to drive the cost of premiums even higher now because the insurance companies are going to have more exposure than they had before. Here is the piece from the New York Times. In another setback for President Obama's health care initiative, the administration has delayed until 2015 a significant consumer protection in the law that limits how much people may have to spend on their own health care. The limit on out-of-pocket costs, including deductibles and copayments, was not supposed to exceed $6,350 for an individual and $12,700 for a family. But under a little noticed ruling, this has been buried in the Federal Register since February. And even the Times points out it was obscured in a maze of legal and bureaucratic language that went largely unnoticed. You think that's accidental? How many other of these live grenades are buried in this thing? They buried this one. It was obscured in a maze of legal and bureaucratic language, so it was hiding in the weeds until they could pull it out at the last minute. It's been in there since February. Nobody knew it. Nobody saw it. Federal Register is hundreds of thousands of pages long, and it's been on the Labor Department's website since February. Now they're just trotting it out when they needed to try to contain the explosion of health care premiums. The discovery is likely to fuel continuing Republican efforts this fall to discredit the president's health care law. Discredit, forget about it. It's already been discredited. What we're interested in doing is defunding this monstrosity. This is not about discrediting Obamacare. This is about putting this thing out of America's misery. And here's just another reason to do it. Group health plans will not be required to impose any limit on patients' out-of-pocket costs for drugs next year. So you could have $6,350 for medical expenses. You could have another $6,350 for drug costs. The health law clearly established a single overall limit on out-of-pocket costs for each individual or family, but federal officials said that many insurers and employers needed more time. Well, where does President Obama get the authority to do this? This is the law. The law says these caps have to go into effect on January 1. Where does he get the statutory authority? Where does he get the constitutional authority to simply waive it because it's going to make life more complicated for Democrats at the polls in November of 2014? That's what this is all about, trying to put some kind of downward pull on premium prices until after the election, so people will be shielded from the harsh reality of what Obamacare actually does mean. Now, more desperation. Let's grab clip number 3. More desperation. This is Harry Reid. This is how far they're reaching to try to deal with the crisis that they themselves has created. Harry Reid, he says, I hope opposition to Obama and Obamacare is not based on this.
They're doing everything they can to make him fail. And I hope that it's, and I say this seriously, I hope that that's based on substance, not the fact that he's an African American.
I mean, that's just absurd. That's just absurd. Obamacare has got nothing to do with race. The Benghazi crisis has got nothing to do with race. Eric Holder, again, by executive fiat, saying we're just not going to prosecute certain drug crimes. In fact, we're going to withhold evidence. The prosecutors are going to withhold evidence. That's a crime. Anybody does that in a private case, that's a crime. You can't do that. So again, that has nothing to do with race. So this is just crazy stuff. But here's, and now the Democrats are kind of in a tough spot here because they are locked into Obamacare. They are locked into this puppy right now. And I was talking with Tim, our president, and his only hesitation with defunding Obamacare is it's a way of sort of it could pull Obama's fat out of the fire. We could sort of be saving him from himself instead of letting the entire weight of this whole thing rest on him. But the Democrats have already said, look, we're committed to Obamacare. We're locked into this thing. In fact, listen to what James Clyburn said about why they wrote Obamacare in the first place. It turns out it wasn't even to improve America's healthcare system. Let's listen.
The fact of the matter is we will be running on Obamacare in 2014. In fact, we set it up to run on it in 2014. All that we are talking about now kicks in as of January 1, 2014. We will start doing the exchanges on October 1, 2013. We fully expect to run on it, and we expect to win on it. The American people will be the winners.
So Clyburn said, look, we wrote this thing to run on it. That's why we did it. That's why we set it up to run on it in 2014. This was all by design. So they're committed to it. So win or lose, this is like an anvil around their neck. Now, here's George. Now, I don't think we've got time for that. We'll have to save that for after the break. Let me see if we can grab a quick phone call before we go to the break. Let's go to James in Kokomo, Indiana. James, very quickly, you're on Focal Point. Let's see if we can grab James and bring him in. James, Kokomo, Indiana. You're on Focal Point with Brian Fisher. Got about 45 seconds. What's on your mind?
I'll just give you a quick one. On my insurance, I wear an artificial leg. I'm off above the knee. I've worn a computer leg for years. Well, now Obamacare wants to say because I'm on disability, we're not going to allow you to have it repaired, which will run about $4,000, but we're going to buy you this junky leg. It's going to run anywhere between $7,000 and $12,000. Now that's the new sense of Obamacare, of not allowing you having a decent leg to get it repaired.
So what you're saying, James, is you could repair this leg, which you would prefer for less than it would cost for this replacement leg that Obama's going to send you?
Yes.
So in other words, it doesn't make any sense. There's no rationality to it, and it leaves you, it's more expensive and it leaves you worse off.
Right, and then that also makes the other insurance I've got will not pay my Medicare will pay.
All right, well, James talking about this is Obamacare. Raises the cost of health care, reduces access, worse for the consumer. Focal Point AFR Talk, back in 2.